Number 20, oh, number 20. You are still here. Sure, your shift is over.
I'm about leaving, oh.
Have you heard? We just admitted another patient for Lassa fever. And now one of our doctors is infected.
What? Which doctor?
Dr. Champion. She was the doctor that operated on that pregnant woman that was suspected to have Lassa fever. And now I also heard that the assistant doctor, Ayo, who got married, is also having symptoms of Lassa fever.
You don't mean it. Talk of the risks we face in our jobs, though. We need to be extra cautious in identifying and isolating patients to prevent the spread of this disease. We should not lose our lives while trying to save lives, so we also matter, be so.
That's so, my sister.
Come. Did you hear that Nurse Bella is also showing symptoms? I heard she was tested for it, though.
Should we be surprised? How can a health worker be carelessly refusing to follow standard infection prevention and control measures? They always lose guard. Have you forgotten how she was misbehaving during that COVID-19 period?
Oh, that's true. In such a high-risk situation with everyone running here and there, Bella will still manage to show up in the doctor and patient's presence without face mask, saying she forgot to wear it.
Just imagine how ridiculous that sounds when we are supposed to be setting examples as health workers.
My sister, I don't think nursing was her calling after all.
God, maybe now she will stop misbehaving and be more proactive with health protection measures.
Yes, so my sister, she will.
Madam, what is wrong with you and how are you feeling?
I've been having headaches and feverish feeling. I've used regular painkillers, but they are not going away. I'm tired, Jerry.
Okay, I will recommend some tests for you. Take this. Go to the lab. Run typhoid, malaria and COVID test.
COVID? Doctor, why a COVID test? I'm sure this is just a stubborn fever.
You see, the thing is that COVID shares some symptoms with other disease, so we cannot rule it out. Please, you have to do it.
I thought COVID is no longer with us, so.
Madam, we think we've moved on from COVID, but has COVID moved on from us? Come, look, take. This is the NCDC website. We have 15 new cases this week.
Oh, wow.
Nothing to be afraid of. Just do the test, you'll be fine.
Okay, thank you, doctor. I will go now and do the test.
Let me start going and enjoy my rest fully before the next shift.
Good afternoon, nurses.
Good afternoon.
The CMD said all health workers on duty should come to Block C for a meeting right away.
We'll be there.
Good morning, everyone. I've heard about the situation with Dr. Champion and Ayo. We are doing everything we can to support them and prevent the spread of Lassa fever among us. But we need to do more. We need to make sure our protocols are in place and that we're educating our colleagues and patients about the importance of IPC. IPC is Infection Prevention and Control. These guidelines and protocols are always on the NCDC site. Let's not forget about waste disposal too. We need to make sure that we properly dispose of all our medical waste to prevent the spread of this disease. Should you see a cleaner or a nurse not doing this, caution them immediately, or better still, report them to me. Our hand hygiene practice should also not be stopped. A lot of illnesses have symptoms of fever like COVID-19. So before you prescribe anti-malaria drugs, test before you treat.
That's right. We can't afford any more infections. We need to protect ourselves and our patients and our community.
I agree. Well said. We are on the front line of this fight against Lassa fever. Let's make sure we are doing everything we can to stay safe ourselves as healthcare workers and prevent the spread of this disease. We need to be alive to save lives. And what is our mantra?
We lead by example. We will dedicate ourselves to improving health and saving lives in our nation. So help us God.
The Health Tori radio drama is brought to you by the Nigeria Center for Disease Control and Prevention and partners. Remember, Lassa fever is real.